Hey guys, Woodruff here. So now let's talk about, I'm still on the wrong slide. I was like, let's go to the next one. Let's try. Paced rhythms. So we just finished talking about pacemakers. Now we're going to get into paced rhythms. So like I mentioned at the beginning of this lecture, that you do not have to know in depth. Like there's all these different issues that can happen with pacemakers. There's like failure to pace, failure to sense, failure to capture. Things like that. And so you do not have to know in depth about these, but you do have to be able to look at a strip and identify that it is a paced rhythm. And you also need to be able to, like if we had a question where we just described it, know that what you're expecting. So for a paced rhythm, so paced rhythms, I didn't talk about this with pacemakers, but you can either be paced for your P wave or your atria. Oh, is this right? Okay, yeah. Maybe I should, yeah. Oh, I can go to over here. So you can be paced for your P wave or your atria, or you can be paced for your ventricle, or you can be paced for both. And the way that you know that you're being paced is that there are these spikes. So I'm gonna do a square box. See these spikes here? These are all pacer spikes. When you have a pacer spike, and sometimes at first when you're not used to it, it might look like artifact. But once you start to see it, you're going to be like, oh, that looks like a pacer spike. So with this first patient, they are paced, and I know because they have a pacer spike and then the wave. Pretty much the reason they have this wave after the pacer spike is because they're being paced. In other words, if this pacemaker was turned off, they wouldn't necessarily have all these beats. Because when people have pacemakers, it's what's called demand pacemakers. In other words, let's say that my pacemaker, my heart's not working. I have a pacemaker placed. When I have that pacemaker placed, my heart rate's probably already low. So let's say my heart rate's hanging around 55. Well, then the doctor comes in, he puts this pacemaker in, and he sets the rate to 70, which means my heart has to beat 70 beats per minute. Now, let's say that I am up and I'm in the kitchen cooking, working out, chasing after my 5-year-old, and my heart rate goes up to 80 by itself. You're not going to see spikes on the rhythm because my heart's doing its own thing. Maybe, there's times that my heart can, is able to get to the point where it can do some by itself. Think of this as like a backup generator. So it comes on when it's needed. So if there's these spikes here, that means it's taken over because the heart's it's not pacing itself the way that it's supposed to. So anytime you see a pacer spike and then, either a P wave or a pacer spike in a QRS or both. This is saying that this pacemaker is serving as the pacemaker for the heart. The heart's not doing it by itself. The rate is lower on its own. So, pretty much the pacemaker has to take over. So think of it as like your backup. It's got to take over since your heart's not doing enough. So needless to say, all you're going to need to know is that what a pacemaker on an EKG would look like. If someone has a pacemaker, they have these spikes before. And so I know someone's pacemaker is working if there is a spike before and that there's actual, something happening right after. Things that you might want to note is that you can see here, look how, remember we talked a little bit about a wide QRS. You can see it's like bigger than the 3 small boxes here. This is a wide QRS, but the reason it's so wide, and this probably looks really strange, it probably looks like a really yucky rhythm, but this is just a paced rhythm. When someone's ventricular paced, it's not their own heart that is sending the signal. So when the pacemaker sends the signal, the rhythm's going to look a little different. I'm not going to get into really deep like electrophysiology about why that happens, but just realize that it's really common and normal for, it's expected for a person who has a paced rhythm, especially ventricular, when we're talking about ventricular pace, to have a very wide rhythm. It's what's called a paced rhythm. So what I would expect for a paced rhythm is spikes before the P wave and or the QRS. I would expect a wider QRS, and I would expect there to be some sort of electrical activity after that spike. So there should be something coming after the spike. If there's just a whole bunch of spikes and nothing coming after them, that's a problem. But yeah, so like I said, up here, this is the atrial pacemaker where there's just a spike and a P wave. the QRS is doing its own thing. So this person just has a lead on the top of their heart for their pacemaker. This person has one just on the bottom of their heart. And generally, this is what you're going to see. You don't see a lot of just atrial pacemakers. You see a good amount of ventricular pacemakers or dual. And so like this person at the bottom, they have a spike and then a P wave, a spike, and then a QRS. And you see it's that wide QRS again. So they are being, this is a dual pacemaker. There are leads on the top and the bottom of their heart. So I know this can seem super confusing, but just focus on spikes are good as long as they are followed by some sort of electrical activity in the heart. That's what we are hoping for, or the point of the pacemaker is that it's supposed to be taking over and it's supposed to be creating electrical activity because your pacemaker is not working. All right, that is it for pacemakers. Next, sinus tachycardia.